Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today happens to be the World Population Day. And this was started in 1989 on July 11th. July 11th. Why July 11th? Because on that year, 500 crore people, we crossed that population. And that's how we know the UNs decided to have a population day so that, people are aware of unnecessary growth of the population. At the same time, give a better quality of life for the whole family. And that's how they give the slogan and they celebrate this. Now, let us learn from Raj Lakshmi how to do the birth control. Yesterday, she already told the temporary methods, and today we learn the permanent methods of birth control. Welcome, Dr. Raj Lakshmi.
Namaste, ma'am. Thank you for this opportunity. Yes, we do celebrate, we do observe World Population Day, World Population Stabilization Day on July 11th because we have to have a balance. Somewhere there is a lot of infertility cases increasing, maybe in the urban areas. But whereas in rural areas, the population is increasing. We need to have a balance so that everybody gets good health care, good education, good food. So, to maintain the balance, we need to have a balance in the population also. So how do we maintain this? Using the contraceptive methods. As we already discussed, there are temporary methods and permanent methods. So in the temporary methods, we have already discussed pills and intrauterine devices like copper T. So what is the next option? Some people don't want to take the tablet every day, or they don't want any instrument inside their body. So what do they have? They have something called as injection. Injection Antara is the one which is being given by the government. It is a progesterone depot injection, which is
it's a
valid
long
for
acting one. Long
acting. Yeah. They can take it once in 3 months.
Okay.
It can be taken maximum 4 to 6 doses. So till 1.5 years, they can take it. Only problem with this, they are uncertain when they'll get periods. That is one problem. And some people get bleeding up to 10 days. That is one more problem. And there are some others who have all 3 months not getting periods, 3 months amenorrhea. So they get scared that whether they got pregnant again after taking this.
So it causes some amount of tension. Okay.
Tension, yes. So this is one option. We have another option called as subdermal implants, where we put this hormones, that is a progesterones, into a stick-like structure, and that stick is inserted into the skin. It is just below the skin.
Just beneath the skin. Okay.
Just beneath the skin. And that can be there for 3 to 5 years. Now in Karnataka also these things have come, and even in the government hospital.
So when they have the bath and everything, nothing happens to them?
No, nothing happens. It's below the skin, nothing happens. It can't, it does. Usually there is no infection. But maybe if they are used in tropical areas where the sweating is more, the efficiency might decrease. That is just a theoretical assumption, but as so far we have not found it.
No research.
Yeah. So it can be used for 3 to 5 years.
Okay.
So we also have something called as emergency contraception, because people don't want to take the tablets all days of their cycle. So when we give this progesterone in a higher amount, what is popularly known as I pill, and it is available over the counter. But we have to be careful. I suggest everyone takes these tablets under the guidance of a doctor, because it can cause irregular bleeding if they take too often, or it can also cause, it prevents the embryo from getting into uterus. So it can, nidation can happen in the tubes. So they can have
ectopic pregnancy or tubal pregnancy.
Tubal pregnancy.
That is an emergency, because a woman can lose her life if the ectopic pregnancy ruptures and then she comes very late, So one has to be very careful about that.
Very careful not to use that. That is another option. And there are some more options. People are not very happy to have hormones. There is another option, non-hormonal options, where we are using centrochromon or what is Saheli. Again, it is being given by government. You have to
Hmm.
take the tablets twice a week for 3
Okay.
months,
Okay.
then once a week for rest of the time. So this is
Oh.
also freely available. It is
Oh,
called
Sahel
Sahel.
is quite friendly because
Yeah,
it
Central
is
Command.
friendly to the woman, so it is called as
Yeah,
Saheli or a
Sunday
friend.
Saheli, or
Yeah.
it's also marketed as Chaya. So
Okay.
what our government of India has done is we have a cafeteria approach. Whenever you go to a hotel, they give you a menu and they ask us to choose. So same way,
The varieties are there and the woman can choose. Oh, so
choose.
she has a right to choose. Yeah.
When a
Okay.
couple comes to obstetrician's clinic and asks, we want to plan, we want to delay our pregnancy, or we want to have a gap of 3 to 4 years. So
Hmm.
we offer them all the list.
Hmm.
We tell them what is the advantage,
Yeah.
which will suit them, and they will choose. So many
Okay.
are there.
And not
These
only
are,
choosing, it is a free of cost and
yes,
totally
it's all free
free.
of cost.
So instead of
Yes.
going for Bitti Bhagya, they can go for the Bitti thing.
No,
This will
it's all
solve the
very,
problem. That's all. Solve the problem in the family.
yes, very effective
Limited.
ones, ma'am.
Yes.
No
Yes.
problem in that. Okay.
And safe
So
also.
far, yeah. So far, we have discussed all the temporary methods. Now we have permanent methods.
Hmm.
Permanent methods are the ones where we do a surgery to cut either the tube which is distributing the sperms outside, that is the vas
From the
difference,
testis to
or which
the
is,
thing. Yeah.
yeah, or which is conducting the ova. So that is the fallopian tube.
Hmm.
So these tubes are cut. It can be done
So
in male and
in men
female.
it is a vasectomy, and
Vasectomy.
in the woman it is a tubectomy. So
Tubectomy.
explain to
It's a
them.
very,
Yeah.
very simple procedure in male.
Men.
It is called no scalpel vasectomy or NSV, where with a small nick in the skin, they cut the vas difference of both sides and prevent the transmission of the sperms to the
Do
semen.
they do the clipping or cut it totally? Just
Clipping it is
clipping.
actually.
Clipping is done. So
Clipping
clipping
is
is
done.
done
Small
so that the sperms will not pass through.
no, pass.
Okay.
It's a very easy one. But only thing we have to make the people aware, that we have to tell them that some have some misconceptions that will affect their sexual life. They will become weak. Nothing like that
No, that
happens.
is all a
We are
myth.
just,
It is
yes,
more of a wrong notion in the people.
wrong notion.
But
Yes.
suppose they want to have the baby after some time, if something happens to their first baby, this vasectomy, the clip that you have put, that can be removed and recanalized?
Yes, it can be,
Okay.
ma'am, but depends on the surgery, how they have done, and
Success is
the
not, yeah.
experience of the person. If the blood supply and all too much hindered, it may be difficult. Otherwise, there is no problem. They can.
Okay.
Okay. So next in women, what do? We do a tubectomy. Tubectomy is we are cutting the fallopian tubes. So that can be done immediately after delivery, where we call them as postpartum sterilization. Or we can do after 6 months, 8 months, when we call it as interval tubectomy. And this tubectomy can be done either the immediately after the delivery. We can't do a tubectomy, laparoscopy, because the tubes will be bulged. So the clip what we put might fall off. So there can be a failure. So usually we do a conventional tubectomy. But after 6 months, we do laparoscopic tubectomy, where the clips are applied onto the tubes.
And
So
don't you think that these clips are better, because in case by chance something happens to their baby, or the baby dies, and then they are in a tragedy and they want to conceive again, and that time this clipping is better, no, that can be removed and then they can
yes, it is better, ma'am. It can be removed. Even if the tubectomy is done, we can freshen up the cut ends, and we can do a anastomosis,
Yeah.
re-anastomosis, which is called tubal microsurgery, tubal recanalization. But
Okay.
yes, that can be done. But it depends on how the tube has healed. Same way as vasectomy.
If there is a scar and it is very tough, and then reconstruction becomes difficult.
Little difficult. Otherwise, yeah, there has been success. Many cases after recanalization also, ladies have got pregnant and delivered. So it is not that it can't happen. And I would like to tell one more thing here, because we say it is permanent, but sometimes, rarely, maybe 0.1% of the time, there can be a pregnancy despite the surgery of tubectomy. Like if you have put it's
And
more
that
common
also,
in.
it can become tubal because there is a narrowing there.
Yes. It can be. If the clip what we have put has slipped and the tube opens, or
Okay.
when the healing, during the process of healing, if the recanalization happens naturally, so
Hmm.
that it can happen, we do explain to
Very
them that
rarely,
is a
very rarely.
very rare chance,
Very
very, very
rarely.
rare chance of getting pregnant again. It
Mhm.
can be.
And
Again,
one more thing that I would like to tell, the
mm,
recent study has shown that in India, the population thing has birth rate has come
come
down
down, birth rate
considerably,
has come.
considerably, and especially in Kerala, Karnataka, and some of the states, it has gone below the normal. That is, it has gone below 1.9. So that
Yes,
means, that their progeny, their family, the name will not remain at all. They will be totally
that is
eliminated.
the
So
that is the
that is
way.
has to be worried also,
Yeah,
because on
that
one side they have got infertility, and other side the birth rate has come down, and then
mm,
people, those who are going for birth control, they should think twice before they embark on these things,
yes.
because
Mm,
if they have a permanent one, and something happens and they have got it done by after only one baby or two babies, and they have some heart disease or some problem, it is a tragedy.
ma'am,
So I think
yes,
the obstetrician has to advise them also
yeah.
properly. Yes.
Ma'am, I have 2 points here. One is, ma'am, it's the nature's way of controlling the
Hmm.
whatever said and done. Human efforts are there, but I feel nature has its own way controlling.
Hmm.
So where as you said, the birth rate are decreasing. Wherever the education is increasing, the level of education is increasing, the birth rate are coming down. Where
Hmm.
there are illiterate, still there is birth rate is there. So it has to be balanced. And
Hmm.
one more thing, as you said, now people have to decide. We
Hmm.
do have some rules from the government. Like when I said tubectomy, they
Hmm.
should have at least two babies.
Hmm.
And the previous one should be 5 years and it
Hmm.
should be proved by the we have to take a consent from the pediatrician
Oh,
saying that that baby
it's a
is
normal,
healthy.
they healthy.
Yeah,
Okay.
it's
Hmm.
healthy. It doesn't have any chronic diseases which
Okay.
can which can turn hazardous for that baby. So
Okay.
we can't just for one kid we are not allowed to do a tubectomy. We
Okay.
have to
Okay.
wait for 5 to 10 years. If they don't want another one, also we have to wait and see to it
For
that
five
this
years at
baby is
least. Yes.
growing well. Yeah.
Okay.
If
Yeah.
sometimes what happens, we do a repeat cesarean, and the gap between the babies will be just 2 years.
Hmm.
So that time we tell them, we
Hmm.
offer them other methods of contraception for
Hmm.
the safety of those kids. Once they have
Okay.
crossed 5 years and it's proven that they don't have any disease, then they can go for interval tubectomy.
Okay.
So we can't
Okay.
just like that do this also.
I know, I know. I
Yeah.
think there is so much of effort from the government, and also, equally the effort from the obstetricians all over the country. And I think the society should understand the pros and the cons, and then they must consult the obstetrician and plan their family. And that is very important. I think
Yes.
it is not just birth control, it is also having a very beautiful family, also, the
Yes.
stress free and a happy family. And let us wish a very wonderful, happy, healthy family to all of them. And more than that, if they have any problems or any issues or any doubts, they can always ask questions, and Dr. Rajlakshmi will be too happy to answer your questions.
Yes,
So thank
sure,
you
ma'am.
very
I'll be
much.
very happy. Only
Yes.
thing I would like to stress is instead of without planning getting pregnant and going for abortion, be wise and
Yes.
choose any one method of contraception. That will be my message
Yes.
on this day.
Yes.
Thank you,
Yes.
ma'am. Thank you so
Yeah.
much.
Absolutely wonderful message. Thank you.